Hi, it's Dr. Kinga Porter from Whole Health, and today we're going to be talking about insomnia, or the inability to get a good night's rest. You listened to our fatigue lecture last week, and we mentioned insomnia as one of the common reasons for fatigue, so we're going to elaborate a little bit on that today. Insomnia, also an incredibly common diagnosis these days. It seems like life in the 21st century is too busy for us to get good sleep. And that's partially true, because what used to happen when we were cavemen and cavewomen is we would play around outside in the sun. Sun inhibits melatonin production, so we were nice and awake. When the sun came down, melatonin production would go up, which would make us sleepy. We'd crawl into our caves while it was dark and have a good night's sleep. Then the sun would come back up, decrease melatonin production, and we would crawl out of the caves. Unfortunately, that's gotten a lot more complicated these days. Part of that is because our circadian rhythm has been put off, and part of that is because melatonin production is not rhythmic as it used to be. The reason for that is, well, lights. And I mean both artificial lights like these up here and the ones on your cell phone, on your computer, on your television, and especially blue lights. Blue lights actually inhibit your pineal gland, which is a gland in your brain, from forming melatonin for several hours after stimulation. And unfortunately, in today's culture, a lot of people try to fall asleep in front of the television, which short term might help you kind of clear your brain and fall asleep, but long term it's inhibiting melatonin production, and it's a horrible setup for insomnia long term. So sleep hygiene is something that's very important. What that means is a lot of people with insomnia, we have to retrain their bodies and their brains to sleep properly. Meaning, treat yourself like a child. If you've got insomnia, you go to bed at the exact same time, get into a calming routine, whether that's a bubble bath or sipping a hot cup of tea while reading a book before you go to sleep. Whatever it is that kind of gets you calm and sleepy, you need to do the same routine every night at around the same time. And then forget those computers, forget the television, forget your watch. Don't use any electronics for at least an hour before you go to bed. And then over time, that will revamp your melatonin production. Now, this is complicated, and people that work shifts, especially the evening or the night shifts, those people will need slightly different regimens and different things to get their sleep quality better. But for the general population, having good sleep hygiene is going to be very important. The other thing that we really need to do to have good quality sleep is manage your stress. And we know that in today's society, stress is everywhere. Stress actually increases production of cortisol, which is the stress hormone, and our body doesn't know whether we're running away from a physical or an emotional bear. So physical and emotional stress produces equally high cortisol levels. High cortisol levels also inhibit melatonin production. So even if you've got good sleep hygiene and you're trying to do the right things, if you're not managing your stress properly, then you're still not going to be able to get the appropriate levels of melatonin. So the question is, how is melatonin made, and how can we get more of it? Well, melatonin is actually made from L-tryptophan, and L-tryptophan we can get from nutritional sources, mostly from things like eggs, nuts, and seeds, and it's specifically the egg whites that have L-tryptophan, and then that's made into melatonin. The other thing that's really important is the initial product of melatonin is actually made from serotonin. And serotonin, as most of you know, is the happy hormone, happy and relaxing hormone. A lot of people do have a serotonin deficiency, and part of the reason for that is also because of societies and society standards, because serotonin is actually made from natural sunlight. So go outside, be in the sun. If you cannot be in the sun, getting a light box, which is kind of a artificial sunlight, you can get that for inside your house or inside your job, that will help encourage serotonin production. Now, 90% of the serotonin is made in the gut, so if your gut is not healthy, whether it's IBS, IBD, celiac, whatever kind of gut dysfunction you might have, that will also prevent serotonin production. So I would encourage you to get healthier guts as well. And then those are things that can be discussed with your physicians. So a lot of people ask about melatonin supplementation. I am actually a huge advocate for supplementing with melatonin because I feel that most people these days are melatonin deficient, and it is something that's difficult to rebuild quickly. So I usually recommend starting with low dose melatonin every night. There are two different kinds. There's a short acting melatonin, which is in and out of your system in about 3 hours. So if you're a person that falls asleep great with melatonin but then is waking up in about 3 to 4 hours, that probably means that it's worn off and you probably need a longer acting melatonin. Most of the long acting sustained release melatonins out there release over between 5 to 7 hours, so that usually keeps people asleep for an adequate amount of time to get into REM sleep and get the appropriate amount of rest. So other than having good energy levels and feeling well when you wake up, why is melatonin important? Why is sleep important? Well, there are lots of studies showing that poor sleep quality and lower melatonin levels actually are risk factors for things like Alzheimer's dementia. There are studies showing that higher dose melatonin might be able to prevent the onset of dementia. That's still a bit controversial. And there are better studies showing that in especially early dementia or patients with sundowning symptoms, which is when the dementia gets really bad when the sun goes down, melatonin supplementation can really help in those instances. So I would encourage all of you to start being more thoughtful about your sleep and taking the appropriate steps to get better sleep quality, and then supplement with melatonin if needed. And then obviously talk to your physician with any questions or whenever you're starting any medications or supplements. So if you like this video, follow us and share this video and subscribe on YouTube. And then the next video will also be about a fun and exciting topic.